Hello everyone, here I am a community health officer RD. Welcome you all in the medinfohub channel. Today we are going to talk about a fungal infection. So let's get started without wasting the time. Basically, tinea infections or fungal infection are infection of fungi, that fungi known as a dermatophyte. They come from a genus Trichophyton or Epidermophyton. So let's see the pathophysiology of the fungal infection. Fungi metabolize keratin. The keratin is the protein present in our skin, nail, hair. And when this keratin protein metabolized by a fungi, it can cause lesion, scarring, brittleness, dryness. And this is how the fungal infections occurs. And very important thing is the tinea infections or fungal infections are named by their locations on the body. So let's see how fungal infections are classified by their locations on the body. When the tinea occurs on the trunk area of the body, then it called as the Tinea Corporis. If the tinea infections or fungal infection of the foot, then it called as a Tinea pedis. If the tinea infections on the groin, then it is called as Tinea Cruris. And if the tinea infections on the nails, then it is called as tinea angum. If there is a tinea infection on hair, eyebrows, scalp, eyelashes, then it is called as tinea capitalis. And another thing is, what is the tinea favosa? Tinea favosa is the severe condition of tinea capitis, and it is also the fungal infection of the scalp. And the tinea or the fungal infection of the hand called as a tinea manum, and the fungal infection or tinea infection of beard is called as a tinea barbi. So we have discussed the classification of fungal infection in a short. So we are going to talk about each of these in more detail. The first, we are going to talk about the Tinea Corporis. Tinea Corporis, also known as a ringworm infection. This one affects the trunk, and it can occur anywhere on the body, but there are some exceptions like hand, feet, groin and face. The Tinea Corporis is the dermatophytosis that causes a pink to red annular with circular shaped patches, plaques with the raised scaly border that expand peripherally and tend to clear centrally. So the next fungal infection is a Tinea pedis. So let's see what is Tinea pedis. Tinea pedis, also known as athlete foot, it is the most common dermatophytic infection. Tinea pedis means a fungal infection of the foot. It presents a few different clinical signs or presentations. Like one of the most common clinical presentation or sign is interdigital tinea pedis. So it is typically occurs in the 4th and 5th toe web spaces, but can spread to all toe webs. Interdigital tinea pedis. So in interdigital tinea pedis is characterized by the macerations, scaling and itching of the skin. So let's see the next presentation of what Tinea pedis is, the hyperkeratotic tinea pedis. What? Hyperkeratotic tinea pedis. So this is the erythematous, but it involves the soles of feet. And chronic hyperkeratotic tinea pedis manifest as a scaling and thickening of the soles. And the next presentation of the tinea pedis is vasculobulbous tinea pedis. So this is the third type of dermatophyte infections of the feet. Occasionally a postular variant may be seen. This type comprise pustule or vesicles on the instep and adjacent plantar surface of the feet, and it is seen less common. So what we have discussed about the three presentation of the tinea pedis. That is, the first is interdigital tinea pedis, second hyperkeratotic tinea pedis, and third vasculobulbous tinea pedis. So now the next we are going to discuss about next fungal infection is Tinea Cruris. What is Tinea Cruris? Tinea Cruris is a fungal infection of the groin area, and this is commonly known as jack itch. and this is more common in men than women. So Tinea Cruris, it begins in the medial thigh, inner side of the thigh, and also spread centrifugally, means it spread from center to outwards. So and it is also erythematous and elevated. So let's see the associated factors of Tinea Cruris. That are the excessive sweating. Due to excessive sweating in the groin area, the Tinea Cruris can occur. And the next is the diabetes, obesity, immunodeficiency. So these are the associated factors of Tinea Cruris. So let's see the next fungal infections, that is the Tinea Angum. What is the Tinea Angum? So it is basically a fungal infection of a nail. Tinea Angum is also known as a onychomycosis. The Tinea Angum symptoms may include white or yellow nail discoloration and thickening of nail and separation of nail from the nail bed. Toe or fingernails may be affected, but it is the more common for the toenails to be affected. So let's see the next fungal infections is the Tinea capitis. So let's see what is Tinea capitis. Tinea capitis is the fungal infection of the head, eyebrow and scalp eyelashes. So Tinea capitis causes hair loss. It is also a pruritic and scaling, and it is transmitted by the direct contact. And the next fungal infections is the Tinea favosa. What is Tinea favosa? Tinea favosa is a severe form of Tinea capitis. Tinea favosa is the severe scalp infection. Here you can see in this picture how Tinea favosa look like. So, and the next fungal infection is the Tinea manum. So Tinea manum is the fungal infection which occurs on the hand. Here you can see the hand infected by the fungal infection, so we can call it the Tinea manum. And the last fungal infections is the Tinea barbi. So Tinea barbi is the fungal infections of the hair. Tinea barbi is due to dermatophytic infections around the beard area of the man. So in this pictures you can see how Tinea barbi infections look like. So if you think it is useful and if you like this video, then don't forget to subscribe, like, share and press bell icon to get new video notification. Thank you.